I was diagnosed with bipolar, and at that time it was called manic depression, back about 30 years ago in the 80s. I was prescribed some medication, and I was basically sent out the door to try and work and live with my illness. I lived my life like everybody else did, but to be honest, I was really struggling every day, which I can honestly tell you was exhausting. And basically for the 30 years, I got to the point at the end where I made a conscious decision to attempt to take my own life. I woke up in a hospital. I had a chance to be evaluated by the psychiatrist. It was brought forward to me that there was a day hospital. This was an opportunity for me to actually make some changes.
The day hospital program is designed to help patients that require that urgent stabilization, whether they're from the community, the emergency department, or the inpatient setting. It's an alternative to hospitalization. So it doesn't replace inpatient hospitalization. It's strictly an alternative.
Prior to the implementation of day hospitals, patients were required to stay at the hospital, thereby missing loved ones, missing opportunities. They often felt isolated. They felt that it was incredibly difficult to reintegrate back into their community, back into their home life. The day hospital provides them with an opportunity to still get the treatment that they need, but returning home at night to friends, families, communities, that's a real positive.
It was 21 days. And in those 21 days, I had an opportunity to work with a group of people that I would have never met in my life, who were all saying the same things I was. So at that point, it was like, whew, I'm not alone. And I started to realize, you know what, maybe I'm worth it. Maybe I'm a guy that deserves a chance just like everybody else. I didn't understand some key things.
It's almost like one of the missing pieces to the puzzle in terms of our mental health care system. Now with that missing piece, we're able to function as a whole, as an integrated system, and better serve our patients.
They had one goal, and that was to help me find my way. They knew that it wasn't going to be the same for everybody, and they allowed me a chance to be me.
We're so incredibly grateful for the donors, not only contributing, but for believing in us, for giving us this opportunity to change the lives of Albertans who, without this opportunity, would not be thriving like they are today.
They showed me a way to move forward so that I didn't have to be stuck. And now I've got a chance to hopefully have another 20, 30 years where I'm actually getting to thrive.